This video has been funded by an educational grant from Fresenius Kabi Swiss Biosim GmbH.
In the report, it told me that I had a 44% of breaking more bones within the next 10 years. And I was absolutely shocked. I had no idea because I'm healthy. Well, I am healthy. I'm very healthy.
Bone fractures caused by osteoporosis occur in 1 in 3 postmenopausal women. These fractures are a significant cause of disability and account for more than 250,000 deaths annually in Europe. Brenda, 81, was diagnosed with osteoporosis following a wrist fracture. We spoke with her and Donna Rowe of Imperial College Healthcare Trust about diagnosis, treatment, and living well with osteoporosis. What kind of patients does the Fracture Liaison Service see?
And so our role is to pick up patients like Brenda over the age of 50 who've sustained what we would class as a low trauma fracture. So it's never low trauma to the patient. It's always really painful and really, causes a lot of dysfunction for some time for them. But because the fracture is a result of a fall from standing height or less, we term it a low trauma fracture.
What was your journey to diagnosis?
I broke my wrist way back on the 1st of November 2024. And I went to the hospital, the usual. And then I received, during that time, I received a letter from Donna inviting me, would I like to have a conversation with her about the broken bone. I was very surprised but delighted to get this letter. I thought anything helps. So then Donna sent me some information pamphlets, which I read through very, very carefully, and I started to think, at this stage, I did not know I had osteoporosis. And then after that, about mid-December, Donna had invited me to have a conversation with her. And within a few days of receiving the report from Donna, my GP telephoned and told me, gave me an idea of what medication I would put on, recommendation from Donna. And I agreed. I was very happy with that. You'll have to help me here, electronic acid, and also calcium C and vitamin D tablets.
Osteoporosis treatments include bisphosphonates that slow bone loss, biologics like denosumab that protect bone, and anabolic medicines that help your body build new bone. Your healthcare team will help decide which treatment is best for you.
I've had no side effects whatsoever, and I've worked out a little system for myself on a Monday morning when I take this one little tablet, and half an hour, I thought, what can I do in half an hour? It soon passes because you're standing up most of the time, or I can sit down and I read or just be very quiet just for that half hour. Mm-hmm. So I've had no problems at all. I've been very happy. I think if I did have problems, I would have immediately gone back to I could have either contacted Donna or I could have gone back to my GP as well.
Well, with alendronate, it's a once a week drug. So as Brenda's very eloquently put there, she takes it at the same time on a Monday in a nice routine that's working for her. And we encourage all our patients to develop a sort of routine with their medication. You do have to take it in a certain way. As Brenda's summarised there, you need to take it before anything else. So it's the first thing you do when you get up in the morning. Often the fact that it comes pre-tea in the morning is not always well received. And or pre-coffee, whatever your drink of choice is. It needs to be taken in a certain way. Before food, before any medication, and before any hot drinks. And you will just take that with a simple glass of water. And as Brenda says, you can sit down, you can take that some reading time, you can still walk, you can move around. We would just recommend that you don't lie down. So it is an alendronic acid, and we're trying to reduce the opportunity for any reflux.
What other lifestyle changes should patients consider?
So we recommend the same for everybody, and it's very much a general healthy lifestyle, healthy living. So as Brenda pointed out earlier, a good healthy diet, so one that's rich in dairy. If not everyone can have dairy, of course. If it's suitable for you, it's not difficult for you to take dairy. Some people have issues with that. That's where supplements can come in too. A nice balanced diet of healthy, fresh foods. We recommend weight-bearing exercise. Simple walking is a great exercise for improving bone density. Also, as Brenda said earlier, with vitamin D, you can buy supplements very easily in the pharmacy. And unfortunately, we do not live in a very sunny climate in the UK. So we spend many months in quite dark and dank weather. And our vitamin C, as you know, it's synthesized through the skin. Vitamin D is synthesized through the skin and exposure to sunlight. So highly likely that a large proportion of people will be deficient throughout the winter with their vitamin D. And it's a very simple once a day, tiny tablet. Some are even less than once a day, some are once a fortnight. And you can just pop that and get the vitamin D you might need that you might not get from the sunshine and or your diet. Falls are also a risk with osteoporosis, and safe mobility is really important. So we can, in our area, we can utilise other services that sit within the community. So we can tap patients into strength and stability work groups, which has been really positive for those who require that. And we would also recommend with alcohol either stopping completely or at least keeping alcohol consumption to within the maximum guidelines of 14 units per week. So smoking and drinking, obviously smoking is never going to be recommended for health. So we would always recommend discontinuing any tobacco, and we do put patients to the local cessation services. So we signpost that.
So I've carried on just with my everyday life. I think I'm more cautious to look down on the pavement to make sure that it's safe. That is one thing. Another thing that I'm also very conscious of the shoes I'm wearing now when I'm out walking. I'm trying to use the stairs more as well to go up and down. But apart from that, after the shock of knowing what I had, I've just got on with life, and it hasn't really altered my life.
Ensuring a patient feels empowered to understand either that they might be at risk or why they may have sustained a fragility fracture is crucial, and explaining the simplicity of the review process to provide the answer, and how everything can join together in providing a suitable, almost tailor-made treatment. So if Brenda, for instance, had issues with her alendronic acid, she can contact myself or she can contact her GP, and we can look to switch her medication to optimise what she has and to also optimise her experience of being on a longer-term medication. So I would always say information for the patient and signposting to the right sources of information is crucial. The attrition rate from medication for osteoporosis is notoriously high. So from day one, at day 365, roughly only about 14 to 20% of people will be still complying with their medication. So those checkpoints with various healthcare professionals, it's actually strongly indicative of a patient remaining on treatment. And by remaining on treatment, you will actively reduce your fracture risk going towards 40%. So it takes time to get there, but you're basically halving your fracture risk in the slightly longer term.
Remember, treatment adherence and healthy lifestyle changes are the best course to reduce the likelihood and impact of future fractures. Treatment options include oral bisphosphonates with vitamin supplements and injectable biologics. If ever in doubt, ask your doctors or nurses any question, anytime.
It was a real education, and I'm really very, very grateful for everything that I've received. So, Donna, thank you.
Thank you, Brenda. It's great to hear you. I'm really glad, because we don't know how when we reach out to our patients, how that's received. So thank you very much. I appreciate that.
It really is worth the effort. And every fracture saved is a fracture saved, is a lot of pain saved and a lot of costs. And it's worth every patient.
Patient choice is really, really key here as well. So making sure that the patient has bought into the best choice for them is really important.